Now, there's a thing called intervention, and I'd like to refer to you a reference. Reverend Vernon Johnson, the late Reverend Vernon Johnson, founder of the Johnson Institute, wrote a book several years ago called Intervention. It's not expensive. You can even get paper copies of it. And all therapists should have them in their office so that they can talk with relatives who come in complaining about their relatives using it. How do we do an intervention? And it will help you with this intervention. Intervention is not a dirty word. Intervention means you're going to intervene in the progress of the disease. That's important. I have a guilt feeling. I got lots of guilt feelings. And the guilt feeling is that when I was senior resident at the Buffalo General Hospital, I had a resident who would get tanked every Saturday night, every weekend. And Monday he just was not in shape to work. Now this is a long time ago. Is that Dr. Amareus?
Hi, Matt.
There's a great guy. And he knows all of it. Come on up here and do this lecture. Amareus taught me that someday people who go into the hospital with drunkenness will get the same courteous treatment, I'm paraphrasing, that people who go into the hospital with chest pain. Thank you. That's a major donation. Well, intervention means stopping a disease. And this resident physician, what I did was fix it for him. I gave him a light schedule on Mondays so that he is in good shape on Tuesday to work. That was in the 1940s. And then about 10 years ago, maybe a little longer, I read in the paper about a doctor dying drunk when he hit his car, hit a tree, and it was he. I have guilt feelings about that because I was an enabler. I allowed his disease to progress. And that ain't the way you do it. That just ain't the way you do it. That's loving them to death. If you have somebody that's bleeding, you're going to rush up and try and stop the bleeding. If you have somebody who's vomiting, you're going to try and help them get well. So intervention is important. And I would strongly urge that you get this intervention book by Vernon Johnson, the Reverend Vernon Johnson, who was, by the way, was a very moral guy and a very bright guy who had the disease of alcohol dependence, alcoholism. Well, how to do it? You need to practice and rehearse before you do it. You know, it's pretty scary for you as a therapist and very scary for the family. To muster up the courage and the wisdom and the technique for intervening in a person's disease. And so don't take it lightly, but get this book and read it. You need to collect significant others. You need to list, each of them has to list specific instances where they saw the effects of the drug on that patient, on that person. He's not a patient yet. Oh, he is now. What needs to be done? They need to stop, they need to get detox, they need to get educated, they need to get in the therapeutic process. Where? You've got to plan it. When? As soon as the intervention is concluded. Is the insurance lined up? What will be the consequence if you don't go into treatment? And that can be pretty severe. The wife says to the husband, I'm going to leave you if you don't get into treatment. The husband says to the wife, I'm going to leave you if you don't get into treatment. And then you need to rehearse the intervention because it's an emotional experience and you have to get the people who are doing the intervention emotionally stable. Where, when, and then follow through.